Hello, my name is Lauren Easterbrook and I'm a nurse anesthesia student at Mayo Clinic School of Health Sciences. I'm going to talk to you about my capstone project today. The majority of Sentinel events are linked to communication errors. Clear and effective communication is critical in anesthesia as we transition patients through the perioperative period. The handoff of information is a pivotal moment where it can be shared safely and succinctly, or mistakes could be made. National organizations such as the Joint Commission, Medicaid and Medicare Services, and the APSF have identified safe patient handoff as a key area for improvement. The purpose of this project was to implement a process to ensure that the handoff between the OR and the post-anesthesia care unit, or PACU, was clear, concise, and accurate. The first step in the project was to evaluate the practice. This was done through clinical observations. After an extensive literature review and evaluation of current practice, I identified medication reconciliation as a hotspot for errors during handoff. I found that many teams did not have a standardized process, and vital information was often overlooked or even omitted. I spoke with the pharmacy team to gain a better understanding of the common medication errors that occur, patient billing experiences, and also how we reconcile these discrepancies. Following the gathering of our local evidence, the development of an improved process was undertaken with input from our PACU staff, anesthesiologists, and anesthetists. The collaborative nature of this initiative ensured that all stakeholders had involvement in our project. A revised evidence-based process encouraged to focus medication reconciliation, using the computer to verify our accuracy and to fix errors at the bedside. A key step in our process was then evaluating our end users and educating them. To that end, I developed educational sessions that were presented in multiple areas. We did multiple small group roundtable discussions with PACU staff and also large group meetings with our anesthesia providers. The content of the educational session included evidence highlighting the importance of safe handoffs from organizations such as the Joint Commission and APSF, as well as our information regarding patient sequelae of commonly missed medications that impacted our patients, such as anti-Parkinson's meds and anti-seizure meds. Additionally, information about our local practice, such as data from the institution's pharmacy audits, were shared. In total, over 100 anesthesia providers and 170 PACU nurses were educated. Following this and implementation of our new handoff process, I once again observed, practiced, and noticed an increased use of our structured medication reconciliation and real-time error correction of our patients' records. It is recognized that staff are now discussing the medications in a more detailed and focused way and are ensuring that important medication information is passed on to all providers. I've loved working on this project, and it's been incredibly rewarding to observe staff communicating more openly. Prior to the project, many of my coworkers underestimated the errors that were occurring. The project has succeeded in increasing awareness of our problem and has helped staff to be more consistent in their practice regarding documentation and correction of errors. Knowing that this quality improvement project will help my patients and prevent errors has led to continued work and interest in this field for me. I am a new member of the Anesthesia Handoff Task Force, developed by the Anesthesia Department at Mayo Clinic, tasked with transforming and creating safe handoff practices and is system-wide. Thank you, Anesthesia Patient Safety Foundation, for the opportunity to apply for this work.